Welcome to Chapter 3, Program Planning Models in Health Promotion. In this chapter, we explore the tools that guide how public health programs are structured, organized, and delivered. You'll learn what planning models are, why they matter, and how to apply the most widely used ones in real-world settings. Let's begin with the basics. What is a planning model? A planning model is a framework or roadmap. It shows a series of steps, phases, or tasks that help planners develop, implement, and evaluate health programs. First is models bring structure to the planning process. Second is they ensure nothing important is overlooked. Third is they are based on best practices and years of evidence. Let's start with the generalized model. This model is not unique to any one organization. It represents the core steps found in nearly all other planning models. The 5 phases of the generalized model are: first is assessing needs and capacity, understanding health issues, strengths, and resources in the priority population. Second is setting goals and objectives, clearly defining what the program aims to achieve. Third is developing interventions, choosing theory-based strategies tailored to your audience. Fourth is implementing interventions, putting the plan into action. Fifth is evaluating results, using data to assess impact and improve future programming. These phases guide grant writing, budgeting, staffing, and communication. Think of it as your master blueprint. Now, let's explore specialized planning models used across various public health and clinical settings. First is the PRECEDE model. This is one of the most robust and widely studied models in the field. It's divided into two main components. PRECEDE stands for predisposing, reinforcing, and enabling constructs in educational ecological diagnosis and evaluation. PROCEED stands for policy, regulatory, and organizational constructs in educational and environmental development. This model has 8 phases. Phase 1: Social assessment, identify quality of life issues important to the community. Phase 2: Epidemiological assessment, identify measurable health issues and contributing factors. Phase 3: Educational and ecological assessment, classify behavioral influences as predisposing, reinforcing, or enabling. Phase 4: Administrative and policy assessment, assess organizational capacity and alignment. Phase 5: Implementation, execute the intervention. Phases 6 to 8: Process, impact and outcome evaluation, track how well the intervention was implemented, what effects occurred, and what long-term outcomes were achieved. This model begins with outcomes in mind and works backward to design effective strategies. Second is the MAPP model, mobilizing for action through planning and partnerships. Developed by the CDC and NACO, MAPP is used primarily by local health departments. It includes 6 phases. 1. Organizing for success and partnership development. 2. Visioning. 3. Conducting 4 types of assessments. 4. Identifying strategic issues. 5. Formulating goals and strategies. 6. The action cycle, implementation and evaluation. MAPP emphasizes community involvement and systems thinking. Third is the intervention mapping model. This model builds on PRECEDE by offering detailed steps for intervention development. It includes 6 steps, starting with a logic model of the problem and ending with evaluation planning. It's especially useful for translating assessment data into actionable theory-based strategies. Fourth is the Healthy Cities, Healthy Communities model. This approach focuses on community ownership and empowerment. It uses participatory methods to involve stakeholders and local institutions in all phases of planning and implementation. Now let's compare models. Each model has unique strengths. PRECEDE. PRECEDE is research heavy and outcome driven. MAPP emphasizes collaboration and systems. Intervention mapping is detailed and logic based. Healthy Communities prioritizes grassroots input, but all of them share the core steps found in the generalized model. They assess needs, they set goals, they develop interventions, they implement strategies, and they evaluate outcomes. Let's not forget that many real-world programs combine elements from multiple models. No one model fits all situations. Planners often adapt, blend, or simplify models based on community context, funding timelines, or political factors. To summarize, first, planning models are essential tools in public health. Second, the generalized model provides the foundation. Third, specialized models offer tailored strategies for specific settings and challenges. And fourth, knowing how and when to apply different models increases your effectiveness as a health program planner. Thank you for watching this video. This concludes Chapter 3, Program Planning Models in Health Promotion, based on planning, implementing, and evaluating health promotion programs by James McKenzie, Brad Neiger, and Rosemary Thackeray. Stay tuned for Chapter 4.